I'm Sreeshyla Basavaraj, or everyone calls me Raj here. You've been a ENT consultant for the last 15 years, but been in ENT training and other things for almost now 25 years. Trained in India, came to UK, did the full training course in UK, then settled now in small island called Isle of Wight. Work in Portsmouth as part of my job. I'm one of the consultants among the four of us working here. Keratosis Obturans has been there for a long time, what we could remember. This particular condition, basically there's an anatomical problem in the ear canal where the migration of the wax and the dead skin doesn't come out naturally, and it creates a small, like a sump, or what I call it as a pothole in the road, so that everything gets collected and people start having problems, hearing loss, because it blocks the hearing or hearing aid, and in worst cases scenarios it is prone for more infections. And when we tend to clean, it's not easy to clean because of the anatomical defect, and the patient can experience quite a lot of pain and discomfort, and occasionally even bleeding. During my training, I didn't have any experience with surgical options kind of thing. But when I became a consultant in one of the clinics 15 years ago, there was a old lady who used to come almost every 2 weeks to my clinic because she couldn't use the hearing aid. It was getting blocked so quickly. And she was so desperate because to clean it used to take an hour because it was so bad. And it was in pain. She was in pain for at least a day or two after cleaning because it was a very painful procedure. And because of her age, we couldn't put her to sleep every 2 weeks to clean under GA. And she was desperate. She was kept saying, look, chop off my head, do something. I can't bear and I can't live like this one. And this was a main hearing ear where she could use a hearing aid. With other ear was not serviceable. She could hear, but it was not as good as this one. So I looked at the literature, there was not much, then realized what the anatomy and physiology of the ear canal and what happens. Came up with this idea, if I resurface the canal, like repairing the pothole in the road, so that things doesn't get collected and it might help. I was not optimistic that will work, but she was happy to give a go and try. So we tried, and it did work, and she's still my patient. Now she comes once a year to clean, to get her ears clean on both sides, and she's the best patient I can say. Because I was doing for the first time for medical legal purpose and no one has done this one, I thought I'll record. That's the only reason I recorded my video. Normally I don't record every video, every surgery I do. Then CSurgery was coming up, and I already published one of my surgical video for endolymphatic sac decompression in the past. I thought I should upload so that I can share this particular information, which is not available to many people. So that's why I submitted that one. And now I got almost 18 patients with pretty good success for this particular condition.
Amazing.
And that's how I not invented, that's how I ended up doing this case. There is a surgical treatment option available, and it's not complicated. It's easy. It doesn't need any expert instruments or complicated instruments or any extensive facilities in your own hospital. It can be, I do it as a day procedure. It doesn't take more than an hour to do it. If anyone who's doing a regular ear surgeries like a tympanoplasty or canaloplasty, those kind of things, or master surgery, they can do this procedure quite easily. And my colleagues and my friends in London does do these procedures now quite regularly. So not every Keratosis Obturans needs surgical treatment, and it's a patient choice, obviously. And if you look at if they're happy to come get it cleaned regularly, it's more there. It's quite that's a no complex, no complicated procedure. You just come into the outpatient department, just clean your ears and go. But in a long run, that's not cost effective if you're running a healthcare like in England in the NHS, because that will each appointment will cost X amount of money, and surgery is one time if you can fix it. The take-home message for the new people is selecting patient is very important. They had to be very clear with regards to the diagnosis, because they need to differentiate between keratosis obturans and canal cholesteatoma, which is totally different. But canal cholesteatoma can be repaired in exactly the same fashion, but it's not the same. The second is in a younger patient, this procedure works really well because the physiology comes back much quicker. In an older patient, you need to have a patience for the physiology to work. Means physiology in the sense the skin has to migrate the wax and the dead skin itself, not cleansing itself, rather we clean it regularly. And it's older patients who needs a little bit more regular follow-ups until the canal is reset back to normal. So they need to have a patience. It doesn't work straight away. Sometimes it can take up to 2 years before everything comes back to normal. The advantage will be when you clean after surgery, it's painless, it's easy, it is not as bad as when we do the de-waxing, what we call cleaning the ear canal when people got keratosis obturans without any surgical treatment. That's much more difficult. But in a small minor cases or in early stages, you don't need surgery. But if it becomes very bad, where it's affecting patient day-to-day life, it's a very good surgical treatment which can fix the problem without any extra resource. The main reason I'm very I endorse CSurgeries much more than anyone is, one, it's an easy platform for people to access, and it's free for people to view the videos so that they can learn. We can learn from other people as well. And I do peer review for your journal, not done for recently, but I do understand the process. And yes, there will be one more video coming up soon about a facial nerve decompression, which is I need to edit. I didn't have time to edit, so once it's edited I will upload it.
Yeah.